Clark. All right, good afternoon, everybody. Thank you for all being here. Kern Valley Healthcare District. Public notice, or forgive me, public meeting for Thursday, July 13th. Mr. Blythe will be with us soon via Zoom. He's speaking at the moment, so he will be a little late. Basically, we'll call it to order at 2 o'clock straight up. First thing we got here is approval of the agenda. Do you have any changes on the agenda before we move forward? Correction on D2. It's dated
June 30th.
It'll be June 22nd, 27th. Forgive me. Any other corrections?
I didn't have any.
No, sir. Okay. And approval of the agenda.
So moved.
Second.
Second.
Ms. Catherine, your vote?
Yes.
Yes, I'm yes.
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 Thank you. All right, flag salute. Mr. Gordon, you want to lead that?
Place your right hand over your heart, repeat after me. I
Pledge allegiance to the flag of the United States of America, to the republic which stands one nation, God, under God, indivisible, and justice for all.
Ms. Catherine, should you be kind enough to lead invocation?
Yes. Heavenly Father, I just want to thank you for the opportunity to be here. Not only is it a privilege to be part of this board, but it's a privilege to serve in this community. Lord, I just ask that you continue to be with us, lead us in the direction that you would have us to go. And Lord, I know there's lots of high water right now. I just ask that you protect anybody visiting our valley that lives here or that does live here, that you just protect them as they go into these dangerous waters. I just ask all these things. Amen.
Amen. Thank you. All right, our mission statement is on the agenda for all to read in case you wish to read over the back. Next section is for public comment. If we have anyone from the public who wishes to speak or be heard at this time. No. Okay. Moving on to item D, consent agenda. The following action items are considered non-controversial by hospital staff. And they may be approved in one motion unless a member of the board or audience wishes to comment or ask questions. We'll move that off. Do we have a motion to accept the consent agenda as presented? So moved.
I'll second.
Thank you, Jane. Okay. Ms. Catherine, you vote?
Yes.
Charlie? Yes.
Yes.
And I'm a yes. Thank you. Okay, Ms. Deb, foundation report, please.
So Crab Fest tickets are out. And as soon as I got tickets, 52 were sold like that. We've sold another 18 the last 2 days. So obviously we feel we're going to sell out and they'll probably be gone by the end of this month or the first part of August. So that's going very well. River Rhythms is ready to go. We're going to do it at Circle Park. The bands this year are Station Street, Hard Rooster, Chris Canyon, and Angels Roost. Angels is a local band. It's going to be every Friday night, starts at 6 o'clock. We're going to set the band up in the pavilion, so we don't have to put the stage up this year.
Nice.
That should put a smile on your face. So we'll have to put up the, I think it's called the backdrop, the speakers and everything, but as far as the stage, we don't have to worry about that. That's my report for the foundation. For the auxiliary, we continue to do well. We have some of the ladies and gents will be volunteering to go through the crowd and collect donations at River Rhythms, so I'm happy about that. For the month of June, the store brought in over $11,000. There was one additional deposit, however, it was done after the month end, so that'll show up for August. After their expenses, the total income was $96.09. And things seem to be doing really well over there. Do you have any questions?
The bookkeeping that you're doing, who's doing the accounting?
For the auxiliary? I input, they have QuickBooks, so I go over and input it. They pay their bills and then I input what they give me on Quicken at the store. And then anything that has to do with the IRS and all that, Barbara does that.
Okay, so Barbara's take, basically, we're just doing the business
The
operation.
easy
there.
part.
Okay, go. Thank you.
For the foundation, we have an actual
I know.
bookkeeper.
I know.
Oh, that's right.
Any questions?
No, but that's
Good job.
pretty good considering
job,
you're only
yeah.
open a few days a month. Is it like 9 days are they open a month?
3 days a week.
That's
I
really
think
good.
June 30th, I think that deposit was 4,000 something. So we add that to the 11.
They had an additional day, sale day this week.
Yes, they had Christmas in July
Oh,
and
that's
I
right.
heard that was pretty well.
Yeah.
So,
Fantastic.
Yeah, it's really good. And it is neat and clean. I take stuff over there all the time. They probably gonna look at my truck and just go, but it's so well organized, it seems like. So, you know,
We've got
Different.
so many great comments from the public about it as well, that people really now want to go there and shop. And I was talking to somebody at the bank the other day and just, they said, we love that store.
yeah, it's
So-
great.
Nice there.
Very nice. Thank you, Doc. Dr. Finstead. Are you playing Dr. Finstead?
Again, yes. So reporting for the, we had 2 committee meetings this month. Pharmacy and Therapeutics Committee met on June 14th. We discussed our COVID-19 preparations under the old business, or kind of the decreasing preparations, but we also reviewed and approved 1 policy, which was the scope of services for the Surgical Services Department. 3 policies are still in process, which is on abuse, neglect, and exploitation, abuse prevention program, protection, PICSIS for the skilled nursing facilities on hold. The committee also reviewed and approved an addition of a particular drug, droperidol, to the formulary. The committee also reviewed regular reports for blood usage, blood culture caps, medication shortages, environment of care rounds for the pharmacy, SSI, MRSA, AST, Foley cath usage, and hygiene. That's a part of what many of those are reports that we're required to submit now as part of our plan of correction process that we went through. And then just to make sure that those are being reviewed. And then also the medical exec committee met on June 20th. And a lot of what went on in P&T forwards right straight to that. So the committee reviewed, approved the policy, approved by P&T. Again, 1 policy was still in progress for wound documentation and SNF. They also reviewed, approved an addition of the formulary drug that I just brought up. Also possible revisions to the ETOH withdrawal protocol. And then the committee was informed of some old P&T and med staff minutes that were damaged in storage that were placed in a secure shred bin for destruction. Again, we stored records up in the garage is up behind the finance department. Apparently mice got in there and ate through one of the boxes because it hadn't been in there for a while. And,
Is it getting emptier now?
some of it has been going down. Yeah, they've been clearing stuff out. Still got some to go. We talked about getting these things up off the floor or putting them in some other place to protect them. And so Bob and I need to talk about some other means for how we can keep pests out of there. And so, yeah, we're trying to get that cleaned as much as possible. Then last thing I had was committee again reviewed their regular reports, the CDPH plan of correction items that were on there. And so those were all reviewed and approved. So that's the chief of staff's report.
Any questions for Tim in regard?
That was his report. I asked you, I should have waited till
Yeah.
you were talking.
No problem. Okay. Sir, it's yours. Chief Executive Officer.
Sure. Just had a visit this morning with the VA, attended the breakfast this morning over at the VFW. Had a great time over there. A lot of people showed up. We got a lot of input from some of the veterans there, things that they wanted to see. Had a chance to meet with Larry, who's the head of that, who's now the regional head for us. He then reports to Robert. I think they were out here once before, and Robert, who is the director, is now been promoted to director, which is actually probably good for us because it's someone who is supportive of us trying to provide services for them, who's now in that seat where he's in charge of the whole thing. So, so he sent his number 2 person out, Larry, to meet with us, and another one, Clifford, who's really kind of on top of things that are going on down in Bakersfield and so forth. And so we came over here to the hospital, we toured the clinic, our clinic, they saw the mobile clinic. We talked about that, if there's services that we might want to use for them. And then we also toured the Leho building. Apparently, when they were out here last time, they were looking at our building down the street. And so being that we've got that fully planned for, that one was no longer available to them. So we talked about this back here, which actually might work out better because like I say, right now, you know, as we're contemplating whether or not we can actually use that building because of some of the issues that CDPH or not CDPH, Oshpod put on us, because it has to, if we use it as a clinic type thing, it has to be a level 3 clinic, which would require us to replace some of the piping and, you know, the drains and all that stuff to, you know, take those out, replace all the air handlers and everything else. So, but from a federal perspective, they may be able to use that because they're not subject to the state requirements. And so we took a look at that space. They seemed pretty pleased with that. I said, what I really want to do now as a follow-up would be to set up a meeting with the director to sit down and talk specifics, because they still don't have any concept of how often they want to be here, whether they're going to be here full days, whether they're going to be here Monday through Friday, whether they're going to be here, you know, 3 days a month or whatever, you know, or what services they want to provide. So I said it would really be helpful if we could sit down and have a planning meeting where we can sit down and actually talk nuts and bolts about what it is they want to accomplish with their veterans up here, you know, versus, and we shared with them, but that's what we went over and saw as Greg. You know, we see a number of the veterans through our clinics already. And so we talked about if there was an opportunity to expand that ability, maybe we would need some help from them for the recruitment of some additional support, you know, clinical support for the clinic in order to do that. But and they were open to talk about those things, you know, when so we're gonna have a follow-up conversation the next couple of weeks here to see where else we're gonna go with that. Construction is proceeding on the emergency generator. They've dug the trenches from back here all the way around by the ER and around to the past the Bob's building out there. So they're gonna start laying pipe. They actually got to put compact some earth. They got to put in there.
The earth today, tomorrow, and Monday, we're testing the bottom of trench on Tuesday, and then passes. We'll start laying pipe.
Yeah. So that's kind of moving along. And then the plan is over the next couple of weeks that they will actually, once they get those pipes in, they will go back through. There's a sand slurry they pour in there, and then they fill the dirt on top of that, repacked it. And then once that's done, they re-pour the concrete, you know, for those sidewalks and all that stuff. And then that will take them all the way down, and then all of the fences will come down at that point. And then everything else will continue, the work will continue down at the far end of the parking lot down there. You know, where we're actually going to put in the structure to house all the generator and all of the switches and all those kinds of things. So that is moving along. Chris Hall has started. We got him signed up, and he is now our contracted physician. Again, hearing great things about his care that he's provided. Mark was sharing. Mark here?
Yes.
I don't know if you want to share, but anyway, one of the patients that came up here had a significant motor vehicle accident, and Chris repaired his arm and so forth, and it went extremely well. It's very complimentary of the care that he received, not only from Dr. Hall, but also from the nursing staff that was here.
He's not one to freely give comments.
Yes, that's right. So, and I've heard that from a lot of other folks that they just really enjoy him. He talks, just got this kind of Texas drawl. What was it he was saying? It sounds like Conahee.
Conahee.
Yeah, that's what it sounds like. And so, he's a welcome addition back there. So we're happy to have him.
Now he's doing the ER? Okay.
Yep.
So are we still in contract with,
Yes,
I
we've
lost
got,
the name.
we've got Dr. Burrows is still there, Shamus is still there. Matter of fact, we just received a call from Dr. Newell this week, indicating that he is going to be coming back in October, I believe, October, November. Yeah, so he called me the other day and shared with me that he has been out, he put on a bunch of weight, been putting some muscle on and so forth, and just so he's kind of anxious to get back to work and so forth. But he sounded great. I mean, it's as good as I've seen it. I've talked to him in quite a while. So like I said, he wanted to take a good 6 months off just to kind of refresh. So he's going to be coming back, which will be good for us because again, we still are using a fair number of locums physicians, which we pay premium dollars for. So having him back under contract, I will be redoing his contract because his expired. And also Dr. Shamus's. And so we'll get those done and present next time. And so that will help us significantly in reducing some of the costs that we've seen from the other physicians back there that we brought in. CDPH surveys, again, we had, as you recall, both the acute unit, we had a certification and a relicensing survey. We had a recertification survey for the SNF. For the SNF, they brought in 8 surveyors. They were here for 3 days and came up with 3 findings. And 2 of those were picky little things. And so anyways, CDPH showed up yesterday morning. We're here to revalidate. And so for both surveys, they sent a team out after they'd already accepted the plan of corrections, basically to make sure that we did what we said we're going to do. And we cleared both of those. They were very happy. They left out last night, gave Mark a high five. So we're out of here. That was their exit conference. So again, just pleased with that. You know, that both sides have put up their systems in place and they're tracking, you know, and that will continue on. You know, so that we don't lose track of everything that we've done. And so Mark's done a great job on that. Sally's got some great systems that she put up on her side as well. The SB 525 is, again, just kind of give you an update. I was up in Visalia day before yesterday. And just with the hospital council, we had a combined meeting of the Kern County and the Fresno County hospitals. And so 525 came up, and again, just a lot of angst being expressed about that bill. This is the one that would provide for the new minimum wage for all healthcare workers, and that's just on hospital workers. It's physician offices, it's clinics, it's you name it. And so the plan is by June 1st of 2024, it will go to $21 an hour, and by the following year, it would go to $25. Durazzo, who is the senator who proposed that bill, has indicated that she's willing to amend the bill to account for rural hospitals and distressed hospitals, that they wouldn't necessarily need to meet that. And she hasn't really come out and said what that's going to be yet as to whether or not they're going to extend the time for us to get to that point, or whether they're going to lower the rates for us or whatever. That is supposed to be put into the bill. Like I said, this bill has already been approved by the Senate. And so would have to go back to them with any significant change. So nobody has seen any writings yet or what she's planning to revamp in that rule. They went on break as of yesterday. I think they're in session again, 2 or 3 weeks, they'll be back in session again. And so that'll go to the Appropriations Committee. I did reach out to Vince Vaughn, wrote him a letter. He is very much against the bill and will vote against it. And then the hospital council asked me to send a copy of that to them. They were forwarding my letter to the author, Durazzo, to explain. So again, just talking about the impacts that we're going to have on us and so forth. And so so we're hopeful that we will be able to, I don't know that we're going to be able to get out of this one. The unions have already come out and basically told us that if they don't get what they want, they're going to do a campaign, statewide campaign on the next ballot to get that approved. So we'll see what happens. So hopefully we can come to some kind of settlement with both sides to make something reasonable. But we'll see. That's
So
fine.
is there any opportunity in partnering with the unions if they do a ballot initiative
We tried that.
to make sure that the ballot initiative also includes reimbursement of higher Medicare or Medi-Cal
Well,
rates?
it's interesting because the state has already put out that they are willing to work to get us more as a separate initiative to work with us to get more reimbursement out of the state, but nobody's seen anything from that.
Yeah,
That went into effect a year
you
ago.
can't do one without the other.
Correct. And so the hospital association tried to do that last year with the seismic, revising the seismic to reduce the scope of the requirements on that. And so and at the last minute, the unions basically said, the hospitals basically said, we can't support $25. And so the unions basically backed out of the deal and just said that we're done and we will. So they started a focused campaign with several cities to try and get these approved in a number of cities that were that they thought were going to be favorable to them. 2 of those failed. 1 of them did pass, and so forth. And I think it was in Los Angeles. And so they are actually reaching out to the hospital in that community to find out what has that done now that you've had to implement this. And so the issue, though, by going into LA, because a lot of those hospitals, because of the competition issues, are probably paying more
They probably
than we're
are.
seeing out in the rural areas
They're
anyway.
probably already seeing it.
Right. And we know the Bay Area, they're already at those thresholds already. So but for those of us that are not, this is going to be painful.
Yeah.
And so forth. So again, just a lot of going on right now, still negotiating. But then the other one I heard about was Woods bill, which was going to provide the relief for rural hospitals on the seismic upgrades. And we actually are one of the facilities that qualified initially for that bill. He is working with the governor. They're getting some new language crafted, but they've put that on. He pulled that 2 weeks ago and is putting in as a 2-year bill. So it will continue forward trying to get that approval, but he just needs that support from the other side just to try and get some language changed.
Good.
No, they think they still got a chance of getting it done. There is support to try to help the rurals. After the hospital closed up here, the governor allegedly said there will be no more hospital closures on my watch. And so and then I see articles that were written for Northern Inyo that they're going bankrupt. They have major financial issues going on. Ridgecrest has got major financial issues going on. There's a couple of others we know. Kauai Delta, I met with them the other day. They still have huge issues going on. They were like $10 million or no, more than that, more like 100 million underwater apparently. We're not meeting their bond covenants and so forth. So again, some of them applied for this distressed hospital bill that they came out, they put $150 million on the table to try and help some of the hospitals that were having financial difficulty. Dave and I looked at that, but unfortunately we don't qualify as a distressed hospital with our financials and stuff. So apparently I think Ridgecrest did get approved by that. I think I heard it this morning. And so we'll see. But yeah, they've got to do something with the reimbursement. The passage of this I don't know if it's been signed off yet, but the governor apparently has agreed on this new MCO tax that was managed care. This is one Kern Health Systems and Health Net, they get taxed. And then the monies they raise go in and go back to the government. And then those are passed back to the hospitals. And so that's where our IGT money has been coming from and so forth.
So it's a new IGT program.
In essence, but it puts it out there permanently. Okay, and the government some of that will flow through to the government, and part of that money will also flow through to other programs for homeless and for staffing, they're gonna talk about setting up more nursing schools and so forth. They're talking about developing more primary care physician practices, so residency programs and so forth. So there's a whole bunch of things in there that's going to other agencies. And that's supposed to generate, I think it was 1.6 billion a year from that program. So that is good. Some of that money will flow back into the general coffers for the state, which they can then use for doing other wage increases and so forth. So so that one we're all kind of waiting to see. I mean, everybody was supportive of that. And so and again, especially the public hospitals, because we've already been getting the money from that already. So, but this expands it and makes it permanent, because we used to live year by year as to whether IGT would go away and so forth, and now we know it won't. So that was some good news for us. So it's smart. That answers your question.
Is Ridgecrest designated a rural hospital?
No,
They are,
70,000.
because they're city.
they are they're talking with a couple of healthcare districts about possibly partnering and going for that designation.
They wanted to go for a district hospital designation, right?
Yes.
I told them, talk to me before you do that.
But Tim.
Yeah.
We wouldn't want to be carved out to where we didn't have to pay the money. Everybody else did. We couldn't get anybody to work for us.
Yeah.
So I mean, we gotta go with, well,
Yeah, I was wondering, would that be a concern that you would have
What's
if
that?
we get carved out of the
you know,
SB 525? You know, for a while, do you think we would lose staff? Because they may look at going for the dollar and not looking at what it's gonna cost for housing
Very
and stuff
possible.
like that.
It is possible.
You know, they don't always,
Like I said, we don't know what that proposal is gonna look like as to whether it's just going to be, you know, a gradual fade in that will ultimately get to $25 an hour. We'll just have to wait to see when the language comes out. We don't even know if she's gonna do it. You know, no one's seen anything or heard anything from her since she announced that. And so, you know, we'll see, but
could we just?
it is an issue that we might have to contend with, you know, if we begin seeing people starting to pick up and leave.
well, I'm still waiting for the, daylight savings time to end.
Yes.
Yeah, that was a long time ago.
Yeah, yeah.
Could we just hire twins and pay them one paycheck?
That'll work. That will work all for alternate shifts. That's right. So. Anyway. That is something we'll need to look at.
Catherine, any questions?
No, I don't. Thank you.
Sir. Mr. Gordon?
Good afternoon. So I just have a few things. And I'm kind of getting a little, I don't think I'm going to bring COVID up in the next board meeting because it's pretty much in the rearview mirror, I think, right now. I think we should consider it endemic, which means it's going to be with us, but it's not pandemic and it's not impacting a lot of people adversely. People are getting the cold and even if they have the sniffles and a cold, they're not getting tested to see if it's COVID. So our COVID positivity rate is around 0.4% for the last 2 months.
Is there a vaccination?
I'll defer to Greg for that.
Yeah.
Yes.
Same vaccine that we have.
Same one,
There's no
The one that-
vaccines in it.
so controversial, they say it does work, it don't work, it just so much.
Same thing that's
The
been
the
around
regular
for
flu shot,
about a year.
the regular flu shot works, though, right? I mean, normally.
Every year it has different efficacies. It's somewhere around 50%, 50 to 60%.
But they doing the same thing with the COVID shots, are they changing it to
It's not changing at all. It hasn't changed since it came out about a year ago when the
That's
virus
good.
vaccine came out. So it's the same as it was.
The next thing on the agenda is, or on my report is transportation service has been providing still right around 9 to 11 rides per day. And we're making trips to Bakersfield and Ridgecrest. We did talk last month about putting in some charges and things like that. There were some questions about that, so we kind of put that on hold. But I also know that Current Health Systems is coming up on a new grant cycle, and part of their main focus is getting their members to their services. So transportation is a big part, and I don't know how much Current Health Systems grant cycle money is, but I'm sure there will be a lot of money there for transportation.
10 million a year for 2 years.
So we're gonna try and get all of it.
Done.
But if I only get a little of it, I'll be happy.
Right.
So that's the plan for the transportation service. We're just gonna continue to do what we're doing and not charge for that service. And I don't think that I'm seeing too many people taking advantage of us, except yesterday, Fred Roach wanted to ride and I told him he had to get Silverado. But that was kind of a cute comment, but we don't see, I think the people that we are giving rides to really need that help. And so
It's a good thing. That's why we're here.
the current CNA class is scheduled to have 7 graduate. And the instructors are looking at probably 5 who are gonna come to work for us. There's 2 of those that might come to work for us, but one of them is having family problems in Michigan and may have to move back to Michigan. And there's a few things like that. So I think our attrition rate is gonna be better out of this first class. We also have done interviews on 15 new candidates. We've already lost 5 of those candidates to attrition, but there are 10 solid candidates for starting in September for another program. So we're excited about that too. And I think our new instructor is going to be great.
Are we still accepting applications for them?
I did ask Ben that question and he said that they've already gone through the alternate list as well.
Okay,
So
I would keep it open as long as we can.
we should keep it open as long as we can. And finally, we did talk about, Tim mentioned a little bit about the, during Dr. Finstad's report about the CAPS committee, we met this morning. All of our plan of correction audits were presented, and there were a couple of findings where we discussed deficiencies and how we were going to correct those. And I think we got a good handle on how to do that. So, yeah, I'm confident that our audits are working and we're going to keep it up. So, and that is my report.
Questions, Michelle? No. Mr. Parks? Ms. Cass?
Yes. So Mark, do you have any ideas of what you will replace the COVID report with? I mean, do you have something from this
Yes.
last
Yes, I.
survey or something you're
It's
gonna be
gonna be a
looking at?
surprise.
Okay,
No, I'm not sure.
You gotta be here next
We'll
month.
come up
That's
with-
right.
we will come back next
we'll
month.
come up with something.
Yeah, I just didn't know if there was something from like the last surveys or anything like that.
That,
you would-
like I said, during our CAPS meeting, I can actually go through some of those things if you'd like. When we went through the CAPS committee this morning, there were a couple of areas in the House supervisor log where they missed a day or two, and I had to talk to the House soups, look, like, you guys have to do this, either on a day shift or the night shift. Another shortcoming was we found out that the PC backup machine that the House supervisors check every day, there were periods of time when it wasn't backing up our electronic health records. And so we discovered that. Beth in Carrie's department did some really good groundwork with CPSI to find out what was going on. I think they got that solved. So
Okay.
there are things that we discover in the CAPS committee. I mean, I could bring a detailed report, but
No, I'm just wondering if you had, I mean, because like you said, I'm gonna stop reporting on COVID, I guess, unless something changes, but
I could replace it with something.
Preferably not another.
We don't want another pandemic.
Right.
Exactly.
right. All right, thank you.
Thank you, sir.
All right.
Dave? You ready, sir?
Yes, sir. Thank you. Good afternoon. Before I go into the numbers for May, I wanted to just give a brief overview of some behind the scenes activity that's going on that has a certain amount of significance for us financially. One is ongoing phone calls and discussion has paid off for us as it relates to our rate range IGT as it relates to Adventist and Tehachapi. They have formally now withdrawn from the program and admitted that they qualify. So going forward, we've already had some good discussions with the health plans that it looks like the vast majority, if not all of those payments, should be coming our way going forward. It could be as much as $1 million a year extra on IGTs now that we've cleared that hurdle. On a formal basis, they've withdrawn, and so we're in real good shape in terms of us knowing that we should be receiving the higher amounts that we were thinking was coming to us. On another issue, there's the fifth period. It's called a single audit report that I have to do for the HHS COVID money. Just to let you know, in total, we've collected 6.5 million of COVID money going back to 2020. Of that 6.5 million, 5 million has already cleared audits that we know for sure we don't have to pay back. Well, this is the last 1.5 million piece that we have to submit the report due September. And the good news is we've already put together the numbers in the report, and we're pretty confident. It looks like we're in good shape that like the other ones, we will not have to pay any of that money back. So we will have finally completed all 6.5 million and not had any at risk for payback. So that was also some progress there. And then lastly, the most important fiscal issue is we're getting close within weeks of finding out about our $22 million FEMA grant. So that obviously will really have a major impact on us financially, hoping to get that back in August, is according to Bob's projections. So those are going to have the most significant, but all three of those obviously are very important to us financially. And I'm going to go into the month of May. And I'm going to start, I'll give you some time to get there. We're going to kind of go deep into the report and work backwards. Page 33 is a 13-month trend report. And you can see on line 6, we can see some favorable trends since February, going from 8.3 million up close to 10 million now in revenues, each month getting a little busier as we move through the end of the fiscal year. But the reason I wanted to start with this report, if you look at the columns, so you've got the second column here being April and the first column being May. Well, the bottom lines for the month are very similar, and it's mostly due to line 29, which is the I had to change the description because now we have a new program starting this year called ERC, and you can see this is 3.4 million of this money is ERC. The last 2 months have really made the difference in our bottom line. The two amounts combined, 1.8 million, 1.4 million. So May was a similar month to April, thanks to those payments. They came in, 50% of it came in April, and the other half came in May. So the bottom line for the year now is up to a healthy 2.2 million, as we expected over 2 million for the year. And we're right there already at the end of May, 2,227,000 in the total surplus. Excuse me, I'm having some allergy issues, so my eyes are just watering and I can't really see the screen, so I apologize.
That's on page 32.
I'm going to go back to the stats now. We'll go into some of the detail. I created a new column this month called it year-to-date variance versus prior year. And I only picked up ones that are fairly big picture significant, and I put a box around them. Unfortunately, this year, a lot of these compared our year-to-date after 11 months compared to the same period last year. You can see minus 4.4% on line 1 acute discharges, 13% on patient days. Long-term care, 4.2% lower. The good one out of all these is ER visits are up 5.5%. So we can see the trends here been a little bit slower of a year this year, but even despite that, we still are showing a nice healthy bottom line. And we have even increased our adjusted strength index with the higher amount allowed by the banks for days of cash on hand, which is now up to 260 days that they are showing us for liquidity. And that's a big part of that index measurement. And it's up to 5.67. So, you know, that you can stop right there and have a hard time finding too many other hospitals showing greater than 250 days of cash on hand. We are in a very small minority of hospitals with that much liquidity. So that's a very positive financial status we have. There's the 260 days in the on page 28, in the far right corner of what our cash is. And by the way, this year we have not lost any cash. It's been pretty much at the same level it was at the beginning of the fiscal year. And that's despite the fact that we had another $1 million or so in capital spending and another $1 million or so paying off a long-term debt. So that's $2 million, and we still have of other big ticket items and not have to take money out of the bank and lower the bank balances. We've still kept our bank balances high despite the higher amounts of paying off the debt and the higher capital spending. So I wasn't going to go into too many other things other than that, and just allow for time to ask for questions. We did do some new reports at the very end of the report related to the investments, so that we had it on record that we were showing an annual investment report. And then also we showed this page 40, where we have a much higher percentage than the average hospital of our government payers, 86.4% government payers. All hospitals have had increases, but compared, we are on the far end. Like, there's only about 10 or 15% of hospitals that have even a worse payer mix than we do. So we're really compromised, because the statistics are real clear when they look at the stressed hospitals. It follows pretty close that the hospitals that have a higher percentage of government payers are the ones that perform poorly. So we have that already have that as a limitation. Despite that, we're continuing to operate fairly well, despite not having the best payer mix. So that was the point of doing this presentation. And then on the investments, this entire amount of balances and interest rates, it nets out to about 4.6% rate of return. And we've got the vast majority of our money invested earning interest. So we just want to make sure we capitalize on the current market conditions as they are, as they've really improved a lot over the last year. So that's my report for the month of May.
Mr. Elliott, questions? Oh. Mr. Parks?
Oh.
Ms. Catherine?
Yeah, so the ones that are maturing, those are just being put back into the system?
Good question. No, we are bringing it back in-house. We have bills to pay. We're expecting to really start kicking up our capital spending if we get, especially if we get the FEMA grant. So we're prepared that as each one of these mature to, for example, we had $1 million withdrawal out of the UBS program back into our checking account so that Barbara could pay some bills. So that's why we laddered our investments in such a way that we knew when we would need the money, and we assumed that when each of those ones mature, that we would then withdraw the money and bring it back into the checking account.
Okay, thank you.
Yeah, we got two questions for you.
Okay.
First one on the 1.5 COVID. Have we filed the paperwork on that last 1.5 or are we preparing it?
We're preparing it. I made reference to it because the piece that I think is the most important, we've cleared that hurdle. So it's not official yet, but my confidence level has gone up a lot, having actually worked the report. The way I do it is I fill in all the blanks and I don't hit the submit button, but I go back 3 or 4 times and make sure it's accurate before we finally submit it. But I haven't done that yet because I haven't, I want to make sure, we've got till the end of September. So there's no benefit for us getting it submitted any earlier, but I do have it all completed and the numbers look real good.
Once you submit, what's your normal turnaround timeline on an answer?
For this particular program with the way the federal government works, the way my experience is, no news is good news. As long as you don't hear from them, you're probably in good shape. And we have did not hear from them on our other 4 submissions. And then finally, the auditors do look at it one last time and there is another formal process that happens like 10 months after this even. But once it's submitted and nobody says anything after a couple of weeks, I think that's pretty much a good indication that we'll be off the hook and not in the clear as far as not having to pay back any of that money.
Have you ever received a documentation on any of the previous submissions that it was approved?
Only from our auditor, Rick Jackson. He does the final, and he sends me a report that says we have officially been passed on our single audits.
So basically, the way I'm going to approach it is once we hear from Rick.
Yeah, good point. I have a tendency to get ahead of myself and make comments, but you're right. It's not official till it's official. It's not definitely until we hear from Rick. We still have a certain amount of risk.
All right. And then obviously looking at the bottom line number, clearly, if it wasn't for the ERC numbers, we would not have hit the mark we hit this year.
That's true. Our volumes did hurt us this year, plus the higher inflation definitely made our performance less than what we were hoping for. But thanks for the ERC, and then another 1.8 million that didn't come in on the IGTs, and that's doubling up. It's just the delay. It's not a cut. And now we're going to be 4 million higher this current year on that money that didn't come in last year.
That's good. Now let's hope that they hold to it. We'll be doing great.
Yeah, until the money's actually there, it's probably premature to get too excited. But right now it looks like things are going real well.
Thank you. Okay. Moving on to item F, old business shows none. Moving on to item G, new business, unaudited financials. Davis, back on you.
I
wasn't sure why that was there.
Did you
Heidi,
have a health report?
So we put that on new business for discussion because we skipped finance committee last month, which is why it's a separate agenda item.
Got
But
it.
the presentation he just did was essentially.
What's that?
okay.
In that case, it made it easy for you, sir.
I'm gonna let you take the next one too, so got my name on it, but
Okay,
Do
resolution
we-
2308,
Fred,
sir.
because the agenda calls for action, do we have to approve that or accept it?
yes, good.
No, you don't.
No,
No,
not even those.
Okay, thank you, Scott.
we put it under action because it's possible that the board might take action.
Okay.
But just because it's listed doesn't mean you have to. Thank you.
Okay. Okay, so move to item 2, Mr. McGlure.
This is one I was just gonna refer to Dave.
Okay.
But apparently, yeah, we needed to do a resolution for 2 things. One of which was to the investment policy that we implemented. And has there been a change to that, Dave, which is why we're doing this?
No, we're presenting it today because of the comment last month by Scott saying we need to do this once a year. So nothing has changed since the last time we presented the investment policy.
Okay, and then the second was obviously formally accepting the budget, and that's needs to be done by resolution as well.
Yeah, and we had the budget approved last month, but we didn't do a resolution.
Yeah, so typically what you see is you're required to review and approve your investment policy annually. So what the vast majority of agencies do is at the start of their fiscal year, they approve their budget and they review and approve their investment policy, and they do it all in one fell swoop. So that's what I was talking about a little bit last month, and that's what we put together for this meeting.
Need a motion.
So I don't know if you need me to read the motion or.
Please.
I'll make the motion. To approve the
Thank you. James.
investment.
Second that. Thank you, Ms. Charlotte. Phil, your vote?
Yes.
Yes,
Ms. Catherine?
Yes.
And I'm a yes. Okay, thank you. Thank you. Get off. Okay, item 3, Mr. McGlure, resolution 2309.
Right, as Scott had mentioned last time, in order for us to consider to do a program to recognize the employees with those funds that we've been talking about for the ERC program, we needed to have a resolution. So Scott drafted this resolution. And basically what we're doing is we're looking to take some of those ERC funds that David mentioned before, and I think it's roughly $787,000, and provide that back to the employees. And so we went back and we looked at the qualifying period under which we qualified for those funds, which was April through September of 2021. And then the decision was that we would go ahead and just continue that through the end of 2021 for that full year. And then what we did was, because we wanted to recognize those that have come on, and again, because some people have worked very hard and so forth, that we decided that we would take a portion of that and pay that out to what we call the new hires for that from that period on. And so they got a slightly less amount. And you know, again, recognizing their efforts, and obviously wanted to make sure that they understand that we value them moving forward and hope to retain them and so forth. And so, you know, after comments that the board had presented to me and so forth, I went back and kind of remodified this report or this distribution model into 2 categories. One was the eligible employees. These are the ones that went back to April, from beyond April 1st period, that worked through that period up through the end of 2021. And from there were 130 full-time employees and 21 exempt employees. Then there are 18 part-timers and 22 per diem in there. And so the bonus that we had decided on was 4,000 for the full-times, 2,500 for the part-timers, and 2,000 for the per diems. And so, and then for those that have been hired on since January 1st of 2022 that are still here, and the whole point of this is they need to be here as of the date of the distribution. So if someone leaves before then, you know, again, this is a retention thing. So again, for those full-time people, they would get 1,800, 1,200 for the part-timers, and 750 for the per diems. And so this is where we came up with it. Puts us right about $785,700. That piece off to the right-hand side there basically shows the monies that the employees receive from the state bonus. In other words, the board authorized us to give $500 for each of the employees, which we did. That was back, I believe, in November, December of last year. And by doing that, then it qualified the employees for the $1,000 for the full timers that the state was going to put in and they agreed to match up to another $500 above that. So if we put in 500, so that, or they actually ended up with $2,000 from that. Again, the part-timers got $1,250, I think, from the state and $350 from us. And then the per diems got $1,000 and $250. So that again, because that was state control, that applied to everybody, didn't matter. You know, they gave a very specific defined period as to the employee worked during these times, they got the bonus. So anyway, just to kind of show you that these others have gotten some other funds that came out as a result of this. So this is where we're at. And, you know, again, I respectfully request the board to approve the distribution model and the resolution. Obviously, that would authorize us to go ahead and make those payments. Unless there's any questions.
I got a question.
Okay, go ahead.
Except January through September that you're using, then you start again in 22. There's a 3-month period. If we hired somebody during that 3-month period, are they out in cold?
No, we went from April to December 31st of 2021. And then the new employees were January 1 of
I
22.
thought it said September.
No,
Well, okay.
that was just a qualifying
That
period.
was
We
qualifying
extended it out to the end of the year
But you
so
still-
that we didn't have that gap. Right. But actually put some more employees in there.
I think the school districts or some of them make a little bit of exception where if you're in the industry or you work or whatever you were working for, and isolated, but you were in the horizontal bounds of whatever during that period, could you make a little difference in that?
That's right.
What I'm saying,
They're employed by another healthcare provider during that period.
not just new to the industry.
Well, that would only apply for the state funding because they would have gotten paid one or the other. I don't think they were eligible for more than one.
I'm talking about our new hires, if they came here to us from another hospital.
Okay. And so if they're in that new hire employee pool, then they would be getting distributions from here. So,
Okay, they should be getting a little more than just somebody wasn't involved at all. You follow me?
yeah. Yeah.
You see what I'm saying, Catherine?
I do.
Yeah, I do.
So for the qualifying period,
Yes.
if an employee worked for another healthcare provider and later came to the district,
Later being after the qualifying period.
after qualifying period, they're a new hire.
Yeah.
Gene is saying is, can they qualify if they were working for a healthcare provider
At least
during
for a
the
little-
qualifying
some more.
period?
Why would we want to do that? I
Well,
would assume that would be up to the former
Because-
employer to do that.
because if I was the employee, I'd feel like you really should, I feel like you weren't treated. fair. That's,
Well, the issue, like I said, was we were recognizing those people who were here working for us during that time. That's what this was all about. And again, that are still here, because again, remember, those people have to still be here in order to get distribution.
how
So,
many people do you think we might have that came from a different hospital?
Well, it makes it difficult to go back and verify. How are we gonna verify that information? So we have to do like background checking on somebody's.
Well, HR, when they hire someone, we're only talking a couple years back. HR says, "Hey, where'd you work last year?"
again, I don't know what difference that makes.
So-
Again, we're recognizing people that work for us during that period.
And
So-
remember, it's a federal credit to reward employers who did not lay off their employees during that COVID period. And so it is really specific to the district employees, the ones that we kept on. Now, of course, we're not like a restaurant or a gym or some other business that had to shut down. We had to retain those employees in order to stay in operation. But it is specifically for those who worked for us during that time that we retained. And not for those who worked elsewhere.
I don't think it's fair to the employees, but I don't know how many of them's there. Like you said, Heidi, might only be 10, might be 5. There's only a grand total of 21 plus some part-time. All right. That's all I got to say, sir.
I think what you're recommending to us is good. I think it's fair. I think it rewards those employees that stayed with us through the tough times. The fact that you've included the new hires in it. I see it differently the way Gene is. I think that's a wonderful bonus. Because we need them on board. We're providing this incentive, for them to stay. I think that's a good way to address it. So, I like the proposal. In fact, I'll make the motion to approve this resolution and proposal. Catherine?
Yeah, it's a yes for me. I would approve it. I'd second it.
Yes, that's what, do you have any comments?
You know what, well, to what Jen is saying is, if these employees were working somewhere else when the state one came out, they would have received the state bonus where they were working. So with the one that we're talking about here, we actually didn't even have to give any of the funds to the employees. So, I've talked to Tim about this and stuff, and I think, we're including people that weren't going to be included in the first go around that we talked about. So I'm just grateful that we, are including the ones that we are. And I think as far as the funds are being, the way they're being split up is good. And I think that we're including the full-time exempt where they weren't included in the previous one.
There's a lot good about it.
Yeah, so, but as far as going back and looking and see if they were working in a healthcare setting at the time this went out, they would have got the state of California one somewhere,
The state.
Already.
And ours.
but not ours.
Okay,
My
I'll
only
second
comment
the
on it, I
motion.
feel as a board, I commend all of us because the ERC funds, there's nothing that says that this healthcare district had to share a dime of it with its people, and we're choosing to do that. So I commend all of you for making that happen.
Most people didn't have to stay here and work through that shit.
You are correct.
And I feel so strongly about that they need that incentive money. They stuck with us, through the hard times, and glad to do this. I think it's the right thing to do.
I'll second Ross's motion.
Thank you, Gene. Catherine, your vote?
Yes.
Sure.
Yes.
And I'm a yes.
Okay, great. Thank you
Thank
very
you,
much. Our employees will thank you.
Thank them.
Yes, they're very much so.
Australian director's comments?
I don't have any today. Thank you.
Mr. Parks?
No, these seems to be going good. And hopefully we'll get some answer this rest of this month, the next $21 million grant.
Sure. Ms. Catherine?
Well, my only comment was that the meeting was great. Everything just kind of flowed. Not all used to that, but I don't know. Everyone is not here. And whosever idea it was for the board of directors to put their comments in the newsletter, thank you very much. Because my month's coming up.
I gave it to you.
Thank
She asked
you.
me.
He's done
Not right.
it.
Not right.
I just wanted to add one comment, and that is about an hour and a half ago, I received an email from FEMA that says, if you receive your grants, here is the process that you go through to accept it. So that's one step.
They're getting closer.
Good deal. Fantastic.
Oh,
That's kind of good news.
Okay. All right. With that being
See
said,
that piece of-
let's prepare to get entered into closed session. Okay. Thank you, everyone.
thank you for taking this. Oh,
Yes.
I'm talking to you in a closed session. I'm gonna talk to Deborah.
We established. Good luck.
We open up the room.
All right, so in closed session, the board and council discussed the Benson versus KVHD lawsuit. And the board gave authority and direction to the CEO to finalize an agreement for legal services. No other items were discussed, no other action was taken.
Okay. Thank you, everybody. We're adjourned.
Okay.
Have a great day. Be safe, everyone.
Thanks, Scott.
Thanks, Scott.